Thank you very much, Byram, and thank you very much, Derek, for organizing this and having us here. I've been told we're pressed for time, so I will be brief. But I want to bring out my main point that I'm a family physician. I practice medicine in the town of Englehart, Ontario, primarily in the emergency department of Blanche River Health. And I first got into speaking out, seeing the massive harms from these lockdowns on my patients. I've never seen so many suicidal children. I've never seen so many cases of people coming into the emergency department for the first time with metastatic cancer. And seeing those harms, I made a decision to myself that I knew that I couldn't live with myself if I did not speak out. And the reason I was afraid to speak out was because there were rumors in the medical community that the college was coming after people who chose to do that. And I've had many brave predecessors before me, like Dr. Kulvinder Gill, who bravely spoke out anyways. But what happened this spring, on April 30th, the College of Physicians and Surgeons of Ontario came out with a very chilling statement, basically saying that it's the professional responsibility of all physicians not to communicate anti-vaccine, anti-masking, anti-distancing, and anti-lockdown statements and or promoting unsupported, unproven treatments for COVID-19. They were very explicit and threatened investigation and discipline for any physicians who express any of the negative aspects of any of these interventions, no matter what the evidence says. And I have to say, over this last year, I've done a lot of research. Looking into the evidence around lockdowns, but especially around treatments. And I want to especially make a point around a few treatments. One of them, for example, is vitamin D, which our health minister has named fake news. But I want to emphasize that there's over 85 studies and 27 treatment trials. Many of these are peer-reviewed scientific literature that have shown a 56% reduction in mortality in patients who take vitamin D compared to those who don't for COVID-19. But even more so, because that was very early on, what we've learned in these last few months is about ivermectin. We have on our hands a very safe treatment that's won a Nobel Prize. Billions of doses have been administered throughout the world because it's a commonly used antiparasitic that's over the counter in many countries around the world. And world-leading scientific and physician researchers, Dr. Paul Merrick and Dr. Pierre Corey, have been shouting from the rooftops around this medication because at this point we have 97 studies and over 30 randomized control trials that have shown a huge benefit to this medication in reducing the risk of death and hospitalization in patients who have COVID. And not only does this treat patients with COVID, especially when you give it early, but there is also a role, and there's 14 randomized control trials for prophylaxis, meaning taking this medication for high-risk patients early, it can reduce your chance of catching COVID in the first place, which is especially relevant for long-term care homes and for healthcare workers in hospitals. And at this point, the College of Physicians has launched investigations against many of my colleagues, including myself, threatening to take our licenses away for promoting what they call unproven treatments, but what the scientific peer-reviewed literature shows is very well supported in the science around these treatments. And so I've made a decision to myself, likewise, like when I decided to speak out about lockdowns, that I could not live with myself. If I have a patient sitting in front of me who has COVID-19 and they can't breathe, or they're at high risk of being hospitalized or dying, I can't just stand in front of them knowing what I know, a 75% reduction in mortality, and not give this to my patients. But more so, seeing what's happening with the Ontario Science Table, not recommending this medication, even recommending against vitamin D, which I think is unthinkable because the harm is none. This is a natural substance. And they're telling us not to give this to these patients despite mortality benefit. I know there's something going wrong, and I knew I needed to speak out no matter what the college does to my license. because at this point, there's bigger things going on than my career. And I thank Byram for bringing that up. But there's something bigger than my medical career at this point, because lives are being lost, and we need to speak out. And so, thank you, Derek, for having me here to get this message out. And I think we're moving on to Dr. Welsh. Yeah.